It says that it is recording. Good morning, everyone. My name is Michelle Plinus, and I'm the Vice President of Member Development at HPS. And first, we're going to let a few more people call in, and then we'll get started. We see quite a few people still dialing in, so we'll just take a few minutes, but at 10 o'clock we want to start the broadcast. Can someone on the attendee line type in the chat that they can hear us before we get started? An HPS employee, I think you know how to do that. So if there's any employees out there that can type in the chat that they can hear us, that would be great. There's a hand raised. I don't hear anyone. I can hear you. Yes, I can hear you. Perfect. Well, out there, I can hear you, so we can hear you. Sherry says I don't hear anyone, so I'm hoping that she can hear, but everybody can hear us, so that's good news, Chad, that everybody can hear us.
All right.
So that my number's going up quite a bit, so I'm going to let it wait. Oh, we'll start about 10:03 or 4. It's going to be very exciting, Chad, so I feel like we should have music playing.
Maybe in honor of Alex, we could have Jeopardy.
There you go. Just so everybody call knows it's being recorded, and thank you for typing in the chat, because due to the fact it's a webinar, everybody's muted, so appreciate you guys using that function as we go through this. Okay, at 10:03 we'll get started. Okay, 10:03, so here we go. Good morning, everyone. My name is Michelle Plinus, as I said before, and I'm the Vice President of Member Development here at HPS. First and foremost, we want to thank you for attending today and taking the time to join us, and mostly your support of the HPS program. I'm going to start with some brief housekeeping, webinar housekeeping, just so everybody understands how to use the system and how we will communicate with each other during this webinar. As I mentioned, all the lines are muted just to the number of the people on the call. And so we will use the chat function and then also the questions, depending on what you see on your screen, okay? As you have questions, please, please, please type them in the boxes, and we'll be monitoring chat and questions, okay? Both of those sections. Chad and I would like to keep it conversational today, so what he's going to do as he goes through this presentation is pause, and I will ask the questions that you put out there, just so hopefully we can timely answer the questions. And then in addition, what we do after, if we don't get to your questions, there is a function in webinar, GoToWebinar, that will print all the questions out, answer them, and then Scott Anderson from HPS, our corporate communications person, will send out all those answers to all the different questions following up the webinar. Lastly, this is being recorded. So in addition to the questions and answers, we'll also send out this recording. So by chance, as all of us do at times, if you get distracted during the webinar, or if it's so great information you want to share it, this will be recorded that you can share out there to other people at your facilities, or other people actually out there. It'll be a link to the recording. So now on to the topic at hand. I have the pleasure of introducing Chad Browson, who is the Vice President of GPO Sales with McKesson. Just so all of you know, McKesson is a strategic partner with HPS as our sole source distributor for medical surgical supplies to our members. Today, Chad's going to enlighten us on the supply chain challenges. I promise I said that 100 times, but it still doesn't come out right. That we are seeing today out there in the world and the global aspect of what we're facing today. And then lastly, which is very exciting for all of us, is he's going to share some of his firsthand knowledge on the distribution of the COVID-19 vaccine. So Chad, I'll hand it over to you.
Great, thanks Michelle. Can you hear me okay?
We can hear you just fine.
Okay, perfect. Well, welcome everybody, and thank you for taking a few minutes out of your morning to listen to myself, and obviously thank you to our hosts at HPS. As Michelle just said, HPS is also a strategic and preferred partner of McKesson, and so I am happy to not only speak with you guys today, but obviously continue to partner with HPS. Let me first and foremost say I am not a clinician, so I will give you the general understanding and information that I have but I would also put an asterisk to that and say that that information changes not only daily, but in some cases hourly. This is a very fluid situation and process. And so at the end of this, I do believe Michelle just mentioned that Scott will send out any information that I'm providing here today, but also I will send out an FAQ that McKesson has put together, as well as my information that if there are any follow-up questions that you would like some clarification on. I understand with this forum not being an open line, it could limit our ability to have an open dialogue, but I encourage you as much as possible to ask any questions as you can. With that, as Michelle said, I'm a vice president of GPO sales. I've been with McKesson Corporation for 14 years. I've held numerous positions in sales, administration, operation, currently with really my support around the GPO partnerships. With that, I've also been pretty in tune, aligned with really what is going on with COVID and the COVID vaccine distribution. I'm going to be, I can give you real world examples that are relevant to McKesson, as well as some other distributor channels that are out there, but I'm going to, at the best that I can, I will try to give you more general information, because this conversation isn't really about McKesson necessarily, but more about the vaccine, COVID, product distribution, those kinds of things. And so with that, let's jump in. Michelle, are there any questions before we jump in?
Not yet. We're all set.
Okay. So quickly, we are going to cover a handful of things, and I'm going to try to keep it at a high level, and I can try to get as granular as you want. But remember, I am not a clinician. I am not the expert in terms of day-to-day. I'm on, I would say, 5 or 6 different committees and calls dealing with COVID. So I'm very knowledgeable around this process and what's going on. But there might be a question that you ask that I don't have the specific or the specific answer for, and so those are things that I can always circle back with. But we're going to talk about, in the beginning, what really happened March through June. I feel like we can't talk about today if we don't talk about what happened back in March and June. We'll talk about a little bit what happened through the summer and potentially of why you're seeing certain things that you're seeing today. Based around your class of trade. And what I mean by class of trade is you could be an educational institution, a school, elementary school, high school, university. You could be an acute care hospital, health system, IDN. You could be a skilled nursing home. You could be home care. And those are all affected somewhat differently, and you might have questions that are specific to you. And so hopefully we'll kind of be able to explain some of those things that you're seeing today through what's happened in the beginning, kind of through the summer, and then we'll jump into really current, what's going on today, Project Warp Speed, which hopefully you guys have all heard about that, and then we're going to provide you a bunch of resources that afterwards you're more than welcome to research and look into. So let's jump in. What really happened at the beginning in March and June? I will tell you a quick story about myself. I happened to be at a McKesson corporate meeting in Dallas, where our corporate headquarters are located. I happened to be there March 10th, and I know it was March 10th because that is my wife's birthday, and we were celebrating her birthday in Dallas. My wife happens to also work for McKesson in our oncology department, and we were there for a rather large corporate meeting. And during that meeting, there was an epidemiologist that works for McKesson that happened to be there. And this epidemiologist is a brilliant woman. She's smarter than half of us probably on this call. She's also a very, I would say, liberal woman, and I don't mean that in a political speak, but more of she's somebody who doesn't necessarily get scared easily. She presented to us, and this again was March 10th, and she presented to us and she said, "This is coming, you should all go home. I can't believe we're all sitting in this room together, and there was about 100 of us. Basically, after that conversation, they promptly canceled our meeting to give you an idea of what McKesson was thinking, and we all flew home. At that point, I had canceled everything, every meeting moving forward, and that is when, for us at McKesson, COVID started. Depending on your guys' timeline, I've heard some people say they didn't really feel the effects of it until April or mid-April or late April, even into May or June. But what we found out quickly was this was more serious than we thought. And in the end, there wasn't enough product to take care of the demand. One note around that is many of you may or may not know this, but 95% of all PP&E products, that's personal protection equipment. So that's your isolation gowns, your bouffant caps, your masks, I could go on and on, are all made in Wuhan, China, where, ironically, COVID started. So instantly, the Chinese government confiscated, I hate to use that word, but that's really what they did. They confiscated any product coming out of China, and they prevented any distribution company from getting that product into the United States. That created challenges on numerous fronts, right? One, because McKesson, a lot like you and where you guys work, they have enough supply that lasts some people a week, maybe a month, depending on your ordering habits. McKesson warehouses are the same as is Cardinal or Owens & Minor or Medline or any other rather large distributor. Their warehouses are built to take care of the facilities and customers they have for a certain time period, not for months on end. So when you cannot get product continuing to come in, obviously the demand spiked and product was limited. Many distributors at that time, and this is not a McKesson thing, many distributors at that time went on allocation. So you might have been frustrated, you might have felt this, you might have been like, wait a minute, I really need X, fill in the blank, and why can I only get 20% of it, 50% of it, 80% of it? And that is why. Many distributors, as well as McKesson, also they basically blocked any e-commerce company from ordering that product from us, as well as any reseller, because what we found was many people were hoarding and buying up a bunch of isolation gowns or masks and then reselling it online for 100, 1,000% markup. And we didn't believe that that was an ethical thing to do. So in many cases, we went on allocation. Allocation really was to prevent hoarding, to prevent outlandish markups, and to try to get our customers the amount of product that we could. As I stated, your healthcare class of trade was affected differently. Schools shut down, elective surgeries basically were canceled. And so depending on what kind of class of trade you were in, it was a definite shift in the marketplace. The skilled nursing world was affected the most in terms of you couldn't necessarily shut them down. A small statistic, there is 1% of the population in the United States lives in a nursing home setting, but over 40% of the deaths that happened in COVID were from nursing homes. And so the skilled nursing home space was affected greatly. At that point, because the demand was so high, there was a lot of companies that stepped up, and I feel like it's important to talk about that because in many cases it shows really what the United States can do when it comes to needing a call for action. But companies like Walmart, as they were shut down, they had textile companies all over the world that were sitting empty. And so they stepped up and used those textile companies to start making isolation gowns. As an example, they were making 10 million isolation gowns a month. Companies like Hanes that makes t-shirts started making masks. You guys probably heard all of this. Tesla started making concentrators, O2 concentrators, and respiratory machines. Honeywell started making N95 masks, which still is a problem today. but other companies started stepping up. There were a lot of stop buys around other places around the world and saying, hey, we'll buy X from you out of Bolivia, as an example. So really there was a move away from trying to buy from China to other places. I call that out because maybe you were affected by this, where in many cases, because there was such a demand and there were so many needs of the product, that people were buying product sight unseen. They were buying product where there was a lot of scams out there saying, hey, if you just give me a PO that you're going to buy X, we'll ship this to you. And once they cut that PO, they either didn't get the product shipped or the product quality they received was really poor. And so I would say if that affected you, I apologize. Obviously, that was not something that McKesson was trying to support. But I would caution you as you move forward, if you were in a spot where you are really short on product to this day, I would caution you where you get it. Make sure it's a reputable company. Make sure you understand who they're buying from. There are a lot of mid-level dealers out there that are really peddling a bunch of poor quality product, and at that point, you're probably going to get taken. I'll pause there. If there are any questions about the beginning, about you specifically, if there was any concern that happened, definitely feel free to ask any questions. Michelle, any questions on the line at this point?
No questions yet, Chad, but I will interject the fact that many of you receive emails from our contracted department, again, from our corporate communications. So just a reminder, as you're looking, as we still go through this pandemic, if you're looking for any products, any PPE supplies, please reach out to HPS. We have a process to vet suppliers. You may see Nathan Stock on the call. He's our clinical director of contracting. So just know that we can be a resource for you at any time as you are looking for those items. So thanks, Chad, and go ahead.
Okay, so moving forward, and I know you guys are probably saying, just get to the point of the vaccine. We all want to know about the vaccine. So I will try to run through this rather quickly. As demand skyrocketed, and I can give you an example, to this day, McKesson receives orders for 10 million N95 masks monthly, and yet we only receive 6 million a month in product. And so just to give you an example, demand is still very high. But as the summer progressed, and I'm talking your summer months of July and August, most states started opening. And so when states started opening, restaurants were opening, other locations were opening, the general usage of these same products crept back in. And so now places that never had a need for gloves or masks or isolation gowns or bouffant caps, I could go on and on, all of a sudden needed it. So that even made the demand skyrocket. It made it even go higher. With that, there was an issue where now the non-PPE products were starting to be affected. As an example, everybody wants disinfectant wipes. To this day, disinfectant wipes are still one of the hardest products to come by. And it's not because there's not enough product of the disinfectant wipe, but because there's not enough plastic to make the tubs that the disinfectant wipes come in. So what we saw was a domino effect to where, in many cases, the government was redirecting product to make bins for tubs. But when that happens, then there's a shortage of plastic for syringes, for needles, or for even sharps containers, as an example. So respiratory products were starting to run low because of the reallocation of that product being needed for PPE items. So we are watching that closely. We're seeing that affecting many other products. As I said, it's a domino, and that's created all kinds of issues. Let me talk about gloves for a second, because I'm sure many of you are seeing a couple of things going on with gloves. You're either seeing a glove shortage in terms of you're probably only receiving some sort of allocation. You're either on a rolling back order, maybe you're even just on a back order completely, or you're seeing prices spike. All of that is true. I'm here to tell you that If you are using a reputable distributor, they are not taking advantage of you. There is a massive glove shortage, and that is for a couple of reasons. One, many of you may or may not know this, but all vinyl gloves are made in basically one location in China. All vinyl gloves are made in China. Basically, there's a handful of warehouses and manufacturers in China that make the gloves. So it doesn't really matter where you buy your vinyl gloves, who you're buying your vinyl gloves from. They're all made in the same spot, just in a different package, a different box. All nitrile gloves, the vast majority of nitrile gloves, are made in Malaysia, only in a couple of factories. The largest factory that makes nitrile gloves caught on fire in September, and they had to shut down. So not only is there a glove shortage because of demand, so if you're buying nitriles, demand is extremely high, but there's also a glove shortage because just not enough product is being made or available to be made. I've got a little graph here. Hopefully you can see it. This is a graph that was in October, so roughly a month ago, and you can see that where the demand is still larger than what's coming in. One of the issues with gloves also is, as I mentioned before in the beginning, the Chinese government has been limiting the product that can be shipped. I can tell you from personal experience, in many cases, McKesson will believe that a certain amount of product is coming over from China. We ship it by boat in large shipping containers. And once it comes to the United States, we believe we are getting full containers, and we open the containers and they are half full because product has been confiscated by the Chinese government. And so it's always an interesting side note to be working with the Chinese government and what they will allow to be shipped and versus what we believe is coming in. So if you're sitting there thinking, man, why are my gloves now at $13 a box? It's unfortunately, that is legitimate. It is a major issue. McKesson believes this issue to last really through the end of December. And hopefully by January, we will be in a much better position globally for gloves. Also, another thing that happened was in the summer was testing was finally made available. Your antibody tests, your antigen tests were finally approved. Basically, the first test that was allowed was a product that had been around for a really long time, and they just retrofit it to start testing for COVID. One of the issues there was it was only good for customers who already had a machine. So of course, demand is up and saying everybody wants a machine, but if you didn't already have a pre-existing machine, you weren't allowed to get any test kits. That has since changed, and so now most people have the ability to get tests. If you were in a skilled nursing setting and you're on this call, you should have received, or you'll be on the list to receive, a machine, a test machine, as well as test kits. So that stuff is happening rapidly. But with that, more testing is going on. Obviously, more gloves are being used. And again, it's this vicious cycle. So fast forward to what is happening today and what is Project Warp Speed. If we would have had this conversation a week ago, all this information probably would have been brand new and I would sound like a genius. But if any of you have watched the news over the weekend, 60 Minutes on Sunday, and actually the Today Show this morning really has talked a lot about this. And so I'm sure this is where we'll get most of the questions. So let's dive into what is Project Warp Speed and where are we at? Where are we at today? Product availability is better. We are still, and I say we, I'm talking the general distribution public, are still on allocation. The reason allocation is still happening, so if you're frustrated with your current distributor or where you're getting product because you're not receiving full allocation or just you're in allocation in general, there's a reason that's happening. One, because cases are still going up. Every time I turn on the news, every state seems to have broken a new record every day. So cases are still going up. Two, we are afraid, and I'm talking again general distribution public, we are afraid of hoarding. We are also in the midst of flu season. We expect this to be a really bad flu year. So there's a lot of hoarding going on where customers who used to order on a weekly basis, I'm going to make up an example, 10 boxes of gloves a week are now trying to order 20 or 30 boxes or 50 because they're afraid that this could happen again and product could be short. So they're overbuying, they're starting to hoard. And because of that, a lot of distributors have moved to an allocation process to get you what you need and prevent the hoarding, because if you start hoarding and everybody starts hoarding, then we will run out again. If you are a customer that has a need for more, you have positive tests within your facility or your location, then you just need to let your distributor know. And most distributors then will ease the restriction on your allocation, and they will put you as a priority, and they will get you more product. So let me say that again. If you are a facility or a location that has positive tests and you need more product, just let your representative know, your distributor know, and let them work with you on getting you what you need. They are not trying to penalize people who want more, but they're trying to support the people who need more, thus again, why an allocation. In many cases, there's actually a surplus of product. So as I mentioned, Walmart started making isolation gowns. Well, now there are so many isolation gowns out in the field that McKesson, as an example, are trying to literally give away isolation gowns. So if you are in a location that needs any sort of gown, an isolation gown, a fluid resistant gown, a chemo rated gown, please let me know, let HPS know, and we can support you with that. We have gowns that are overflowing out of our warehouses. So we are literally giving these away at cost because we just need to get rid of them. We've got too many gowns now, where this was a case of a company is in Walmart stepping up and supporting the needs, and then they overmade. And so in this case, if you need gowns, as an example, please let us know. Please let HPS know, and we can get you those gowns rather easy. One thing that I do need to talk about is with product availability. I've mentioned a lot how the Chinese government controls the flow of these products. The Chinese New Year is around the 1st of February, and nothing can ship out of China 2 weeks before the Chinese New Year or 2 weeks after. So mid-January through mid-February, no product will flow. And so we are also watching that very closely. We are continually trying to find other means of products globally. I mentioned Bolivia. Bolivia, crazy enough, has become a place that a lot of product is now made. Nicaragua, there are places in Europe that are now stepping up and making a lot of product. And so we are trying to move away from relying on the Chinese manufacturing plants, but the Chinese New Year will put a dent into product supply. So just a heads up there. Testing and distribution now is commonplace. It's out there. It's relatively easy to go get tested. The product is continuing to get approved. I actually read just yesterday that another vendor manufacturer is getting FDA approved for a new test coming out this week. And so you shouldn't have any issues around testing or getting that product. If you're having questions around, hey, the government sent me a very specific machine, but I'm having a hard time getting the test kits, please let HPS know, please let myself know, and we can figure out what the solution is there. If you're struggling with even getting a machine, in many cases, the back order, if you want to call it that, on the machines is not due to availability. It's because the government has basically confiscated all the machines that are being made, and they are distributing those out as needed to nursing homes, to health systems, and such. getting into the vaccine and vaccine test kits, which is probably where a lot of the questions are, but let me pause there. Does anybody have any questions around product availability, isolation gowns as an example of products that you're in need of, that there is a surplus, any sort of globalism questions, testing, any questions around that, Michelle?
Chad, we're still good. Good news is everybody's intently listening because I always watch the number of attendees. So
okay.
We have everybody still on the call and no questions yet. So
okay, so
great.
let's jump into the vaccine and vaccine test kits, where probably people have a lot of questions. So we'll quickly talk about the distribution of the vaccine, the kits, what's in the kit, and storage. As I stated on 60 Minutes this week, there was a lot of conversation around the storage of it, as well as even on the Today Show this morning, there was talk about that. You can see I did put a link on here for one place that, and I'm going to use the word potentially, has refrigerators or freezers that could fulfill the needs of cold storage. But we'll talk about that more in just a second. So let's talk about the distribution. So what they're calling Project Warp Speed. Project Warp Speed really is the name for the making of the vaccine. To give you an idea, generally a new vaccine takes anywhere from 5 to 10 years for a new vaccine to be made, for trials to be had, and to be approved by the FDA. Every pharmaceutical manufacturer that makes a vaccine, like Pfizer as an example, they have to go through 3 phases to ever get approved. In many cases, right now, there are several companies that are in phase 3 of that product. So that is a good sign. We have known, I say we as in McKesson, we have known now for about a month that most likely a vaccine will be available by the end of this calendar year. And please don't hold me accountable to that. That is just what we're being told, and that is what's been the general belief for some time now. So if you can think about that, generally it takes 5 to 10 years. We will have potentially a vaccine by the end of this calendar year. And so in 8 months, this has been able to be accomplished. That is amazing, in my opinion. So if there is a product, a vaccine that is available, how does it get distributed? Let me back up and just say McKesson is the sole distributor of this product, of this vaccine. You might ask, how is that possible? How did McKesson get chosen? McKesson, back in 2016, there was an RFP by the federal government, by the CDC. McKesson won that RFP back in 2016 to distribute vaccines, to basically work with the CDC on any sort of natural disasters. So if there's a hurricane, fires, those things, Red Cross, McKesson distributes product and supports those organizations for product needs. And so in 2016, McKesson was awarded that RFP, and this falls in line with that RFP. So this was not something that was put out for bid recently. This was something that was aligned, that McKesson already had the contract. And so just to kind of let you guys know what and how that was done. You can see I've got something there highlighted because that's probably a question that will come up quite a bit, is there will be most likely an ultra cold temperature requirement, and how do I get access to that? Let me first, before I jump into the ultra cold temperature requirement, let me first talk about really how the vaccine and how you as a customer or a general public can get product to access to that product. So here's a graph that I think helps sum it up pretty quickly. On the far left, you see McKesson warehouses. McKesson built 5 new warehouses in the last 4 months. Those 5 warehouses are in undisclosed locations. We are not publishing where those are for fear of people storming the buildings and taking the products, so they are in undisclosed locations. We have been receiving supplies in. McKesson has been creating supply kits as we speak. We have been building these kits. We've hired over 5,000 people in the last couple of months to just help build these kits. Once the FDA approves the vaccine, that vaccine will then be stored in our warehouses, the 5 warehouses that McKesson has specifically made for this product, for this vaccine and this distribution of this vaccine. They will be made in, they will be stored in a cold storage, so no worries there. And then at that point, you as a customer, as a company, as an organization, then will have to work with your state or federal government on what your needs are. Again, you could be a school, you could be a home care, you could be a nursing home, you could be a hospital. You can see the whole list there of potential. Now that's not the full list. That's just an example of a list. Once you have let your state and or the federal government, the CDC, know what your needs will be or potentially will be, at that point, the government will tell McKesson specifically where to ship it. It will be shipped via FedEx or UPS directly to you. It will be shipped, once the order is placed, it will be shipped within 48 hours for you to receive that product. If you aren't sure how to let your state know or the CDC know, at the end of this presentation, we do have a resource of where you can click on and you can look that up. I would say if you have not done it already, I would make sure you do it ASAP, and I am talking today. As an example, I live in the state of Missouri. Last Friday, so 4 days ago, was the last day officially for a nursing home to let the state know what their needs will be. Now, I am not saying I don't want anybody to panic if they're in the state of Missouri and they haven't done it. I'm not saying that you can't still get that in, but I do know that the Healthcare Association in the state of Missouri sent out a notice saying that the last day was Friday. So if you have not done that, I would contact your state association quickly, and I would make sure that they understand how much you need. You do not need an account number with McKesson. You do not need to set anything up with McKesson. You don't need to even really converse with McKesson. You will converse with your state, with the federal government, with the CDC. They then will let McKesson know, and McKesson then will ship that product to those locations. I will have to say this, if you are a current McKesson customer, you do not receive priority. And I want to make sure you're aware of that. So I don't want everybody to go, oh my gosh, let me become a customer of McKesson. We would love for you guys to be customers of McKesson, don't get me wrong, but customers of McKesson do not receive priority for this vaccine. This vaccine will be distributed in phases. Phase 1 really will go to the population that needs it the most, the nursing homes, the geriatric population, health acute care centers. That's where it's going. Phase 2 will go to doctors and nurses and people that need that. Phase 3 will be mostly school bus drivers, city bus drivers, teachers, those kinds of things. The general public will probably not even get access to this vaccine until talking phase 4, phase 5, or phase 6. I tell you that because I want to level set expectations. If the vaccine is available at the end of this calendar year, my mom, who is retired, will not get access to this vaccine probably until spring or early summer. So just level setting that. If the question then is, well, how does somebody in the general public get product? Right now, CVS and Walgreens have been awarded the distribution of that product, and there is not a lot of information out there exactly how that will be done yet, but that will be done through a CVS or a Walgreens, most likely either in pop-up shops within their own stores or through health systems or acute hospitals. And so again, I live in the state of Missouri. KU Medical is a big health system where I live in Kansas City, and so they themselves would have the ability to process the vaccine distribution or the shots. Let me jump into the vaccine kits. So again, preventing hoarding. If you are trying to buy product because you think I'm going to need this product to administer this vaccine, couple of things. These kits are being made at the McKesson warehouses and will be shipped with your vaccine. So if you say, hey, I need 100 doses of the vaccine, then the equivalent kits will be tied together and shipped all together, and you will receive it all at once. So what is in the kit? Needles, syringes, prep pads, masks. Those will all be in your kit. Not included, down at the bottom, kind of middle bullet there, are going to be sharps containers, gloves, or gowns. Those will not be included in your kit. But anything to administer the actual vaccine will be in your kit. So let me pause there. That's a lot of information around distribution and vaccine kits. Michelle, are there any questions I can tackle?
I've gotten a question about, as you were talking about the distribution, what is included in the kit. So
Okay.
just so everyone knows, this presentation will be included in the follow-up email. So I was just typing in there I know people are feverishly writing things down probably on the screen, but know that we will make this available. Chad, that is correct. We can make this available through the
Yeah, absolutely.
email.
Absolutely.
So,
Yep.
and I think the key, I've gotten this question a few times, so I think it's great to know what is included, but I think the key question I've gotten to is what about gloves? And Chad, gloves will not be included in the kit, is that correct?
They will not be, correct. Correct.
And then the next question I just got is, are schools ordering these to give to students and staff? Who will decide this?
So that is a great question. Schools is interesting, and it's interesting for a couple of reasons. One, because school teachers have been deemed to be folks of high need for the vaccine. So they will not be really I don't believe in the phase 1 or phase 2. And again, I'm telling you this, and things could change tomorrow. But school teachers have been put in those early phases. And I'm talking like I know there's been talk of phase 2, but probably most likely phase 3, which is interesting because they're talking about school teachers, but not the school children. So that's sort of an interesting, why I say it's interesting to talk schools, because they're talking teachers are a vital to get this vaccine, but the students themselves really will be more in the phase 3 or phase 4. They're saying phase 3 or phase 4 will be young children and school-age children. That would be a phase 3, phase 4. For most likely, the school teachers would get it first. The schools that I am aware of, and again, I'm giving you just information that I have, do not necessarily need to order this product because you yourselves cannot administer that. You will need to work with and partner with a health system, a CVS, a Walgreens, and there's going to be more information that comes out. And as I receive it, I will let HPS know, and then they can send that out to you guys if you're at a school, how you can partner with them. I do not encourage you to start calling your health systems wherever you live, calling your Walgreens and saying we need to set up some times. I think that's the crazy thing about this, is everybody's got anxiety about needing to do certain things today when the vaccine hasn't even been approved yet. So I would say best case scenario, just understand that this information is being talked about. There will be an organized effort to ensure that schools get the product, that the school teachers get the product, get the vaccine, and that will happen most likely through a Walgreens, a CVS, or a local health system. I failed to mention that if you watched the news lately, this Pfizer vaccine that is promising, I'll put it that way, will be in 2 shots. Now, not all the vaccines that are in their last phase trial is 2 shots, but the Pfizer one is in 2 shots. So there is some logistics around that. Think about that. You have to go in one day to get a shot, and then 21 days later, you have to come in and get another. So that creates some logistical, operational concerns, put it that way, because they expect to do hundreds of thousands of shots a day, and they'll have to stagger that over, one day, next day, and then that 21 days will be floating. With that, the Pfizer product, I'll speak to the Pfizer product specifically, has to be in ultra cold storage. What is ultra cold storage? Ultra cold storage is at -90 degrees Fahrenheit. That's really cold. There are not enough freezers available that are at that low of temperature, that are made to store product in that space. So a couple of things will happen. There are ultra cold storage sites around the United States that will house the product. And as a health system, a CVS, a Walgreens needs the product, it will be shipped to them in dry ice. And at that point, they will be able to utilize that product, the vaccine, to administer those shots. There is a lot of regulations around that. So reason I'm bringing that up is because I do not want you to think that you need to run out and buy a freezer today. You don't need to do that. There's not enough freezers out there. I did, and I'll scoot back to it, I did give you one website that you can look it up, that if you are feeling like you need to just be prepared or educate yourself, feel free. There's an American biotech supply company that does make freezers that do go ultra cold, but I'm telling you, you do not need one of those today. So don't panic and think you've got to have one to get this product. It will be administered to you if you're a school, if you're a nursing home. It will be administered to you through a designated provider who will be ready and able to store this product correctly.
Chad, I have quite a few more questions now.
Okay.
Do you know what phase frontline pharmacy DME staff will be in?
Yeah, so that will be most likely, and again, I'm asterisking everything here, that everything could change quickly, but that will be most likely in phase 2, if not phase 1, because of the need for them to be in the front line to not only administer potentially the vaccine, but any drugs, obviously COVID related. So they'll be in the first phases for sure.
And then next question is, do you believe that child care workers are in the same phase as teachers would be?
That I do not know. That's a good question. I can definitely follow up on that. I mean, I give you my general belief would be yes, but obviously you'd have to be a licensed child care provider, and I think that would most likely qualify. But I can definitely find out for sure and follow up with you, Michelle, and you can send something out.
Yep. And like I say, for everybody on the call, we will download these questions and put in the best of our ability answers that we have and send it out to all of you that are attending today. Next question is, what department do we contact in our state to register or for the vaccine allocation?
Yeah, so there are a bunch of resources for you. But there are definitely, you can contact HIDA, and then at HIDA, which is HIDA, which is really the distribution, global distribution website. They have links to your state, and it's really just your Health and Human Services is really where you would go within the state. And they should, I'm air quoting here, they should have reached out to you or somebody saying, hey, we're basically taking a tally. So if they haven't, I would definitely recommend you get a hold of them and let them know what your expectations are.
Next question is, in the past, people at high risk with health issues were to receive the vaccine in the first phases. Do you believe that, Chad, has changed and those people will be further down the list?
No. So high risk will be first. So folks living in the skilled nursing facilities, folks that are currently battling emphysema, some sort of cancer treatment. I mean, anybody who's high risk will be in that phase 1. That is a guarantee.
Okay. And then, will pharmacy staff be vaccinated through Walgreens and CVS, or each pharmacy can order for its own staff?
Michelle, will you ask me that again? I'm sorry.
So the question is will the pharmacy be able to order vaccines for their own staff and vaccinate them, or will they have to buy, or will they have to go to CVS or Walgreens as the pharmacy staff and get the vaccine that way?
So I guess I'm not sure if I fully understand the question, whether if you're a non
yeah, I'm at a hospital and I'm like a pharmacy tech. I'm not necessarily, so I'm a pharmacy tech.
Yep.
Will my hospital be able to order vaccines for me as a healthcare worker, or since I'm not necessarily front line, would I have to go to CVS or Walgreens?
So that is a great question, and the reason it's a tough question for me to answer because a lot of these phases and a lot of this process still is at a very high level of understanding. And so if your health system has been deemed, or your hospital has been deemed a location that can administer the vaccine, then most likely you could just utilize that there at your own facility, your own location. If it's not, and the reason I'm like hedging here is because they haven't said yet, whether every health system, and again, it really boils down to who has cold storage and who has the ability to administer these vaccines. If it is not, if you're maybe a part of a smaller health system, then you most likely will have to go to a health system that can administer that, or an approved Walgreens, CVS type vaccine distribution place. And I'm not saying it's going to be the Walgreens you see on the corner necessarily. It might be a pop-up shop, but it will be administered by Walgreens and CVS. So I need to be careful there as well. So I don't want you running to your local Walgreens and saying, hey, I heard you're going to get it. That's not necessarily the case, but Walgreens and CVS have been awarded the ability to administer that vaccine. So I would say, I hate to say this, but TBD, that's not fully been developed yet of where exactly they're going to be shipping those, but that's the general thought as of today.
Okay, and I have a clarification on the question. This particular person's at an independent retail pharmacy, and do you think that they'll be able to administer the vaccine, or just
Yeah, so good follow-up. So as an example, there are other pharmacies out there, right? Long-term care pharmacies, Health Mart, other pharmacies out there, Walmart, Costco has pharmacies. The general belief is that through the first few phases, I'm talking like 1 through 6, it will be administered through Walgreens or a CVS. I'm not saying that your pharmacy couldn't partner with one of those. That is possible. But the general belief is that after the first handful of phases, it will be opened up to other pharmacies, the Health Marts of the world as an example, to start administering that. But for the first handful of phases, it will be administered only through a Walgreens or a CVS.
Okay, we're caught up now, Chad, so.
Okay.
What's the question?
Great. So on the screen, there are a lot of resources, and I would say to you, feel free, go research on your own, but here is a good example of a handful that I wanted to provide to you. Operation Warp Speed, HHS, is a great one. The one below that is a really long site, but you can just copy paste it. But that really talks about your administration supply kits, those kinds of things, just to kind of, again, give you a refresher on that. You do not have to be a customer of McKesson to go to the McKesson website to look at a lot of this information. So again, if you're thinking, man, there's just too many websites out there, honestly, your number one spot is just to go to McKesson. And if you go to the McKesson website, at that point, it can take you to 100 different links. But it could be for you one kind of a good one-stop shop for you to kind of get a lot of information that you need. So I give you two links there. One is just McKesson.com, a lot of information. And then there is a very specific McKesson.com around the coronavirus update. And that is updated daily. So a lot of the stuff, as I said, changes hourly. So you can go to that and you can get a lot of information. A lot of information on the CDC. I myself have been on the CDC website. It can be overwhelming depending on what you try to type in the search. It can be a lot. So again, in many cases, it's better to kind of go through the McKesson website and they can kind of direct you where you need to be. And there's a lot of information that can be provided through that. So that is really it. I hope I've leveled some of your thoughts or fears around product distribution, product you're getting, allocation, maybe prices are going up and you're just confused of why am I being taken advantage of, but also around the vaccine. The vaccine is something that we obviously are watching very closely as we are the distributor of that, but I will just remind you, the vaccine will be free. The government is paying for it. So you do not need to start worrying about products to administer the vaccine. You don't need to worry about what's this going to cost me. It will be free. The only thing that you should worry about and make sure that you are doing is letting your state know, the CDC know, the federal government know that you are going to be in need of the vaccine. And then at that point, you should be good. Any other questions, concerns?
Ted, we'll end with one last question because
Okay.
I think it's an important one, just so we can clarify. The question is, how do you store the vaccine once it's received from the ultra-cold storage sites?
Yeah, so it will come in a suitcase-looking kit with dry ice. They will only ship you enough product that will last as long as that dry ice will be available to you. So if you said, hey, I need 100 vials, they most likely won't ship you 100 vials because unless you say, hey, I can give that many shots in one day, but they will work with you on how many shots you're going to give a day and how many they will ship to you in that day. And this is the Pfizer vaccine only. And I don't want everybody to completely get panicky around it because the Pfizer vaccine hasn't even been approved yet, but it's the one that's in the news now. So everybody's now all over this. I need ultra cold storage. There is some interesting side notes to the Pfizer vaccine. One is it's 2 shots. So one the first day and one 21 days later. So you'll have to make sure you're keeping track of that if you're the ones doing the vaccine shots. Number 2 is if it's in the suitcase that has dry ice, when you open that suitcase up, you only have 1 minute to pull out the vaccines, the vials that you need for that time period. And then you have to close it back up. Or your product could go bad. So there are a lot of questions and concern around ensuring that the product is shipped correctly, stored correctly, and administered correctly. That's why to the question earlier about Can kind of anybody, local pharmacies, independent pharmacies, can they distribute that? That's why it is being controlled at the highest level of who at this point in time can administer the product, because of concern that product will be shipped and then potentially go bad for the lack of understanding of how it needs to be used. So more to come on that. As I get information, I will continue to let HPS know. They will continue to send that out to you guys as HPS members. But as of right now, there will only be a handful of places that will be allowed to administer the product for that reason. That's why schools, right? We're not going to ship it to schools and say, hey, you know, have your nurse give the shots. There's just too many things around it that could go bad, could go wrong. And that's for the Pfizer one. Let me correct that. That's for the Pfizer one as of right now.
Okay, well, Chad, we're at the top of the hour, so I just really wanted to take a minute to thank you for participating in this call today. It was great information for the members. We know you and your team are crazy busy during this time, so thank you for giving us this hour. And then most importantly, also, could you pass along our thank you to McKesson, your company's dedication to the HPS membership and keeping us informed during this ever-changing environment. So we really appreciate all that you've done for us today.
Absolutely. Thank you guys so much. Thank you for being members of HPS. As I said, HPS is a really strategic partner for McKesson. So if there are any other questions that come up, if you hang up and you're thinking about this conversation, you're looking up resources, please reach out to your HPS member, reach out to me directly if you would like to, and then we'll try to address those as needed.
All right, everyone, thanks so much for attending today, and please let us know if you need anything else, and we'll be following up with emails and the recording of the call today. Have a great day, everyone.
Thanks, everybody.
Thank you.